how that may have been presented to us or not.
Absolutely.
Yeah.
Absolutely.
But it wasn't more of an issue of putting people away. I hate to say it that way.
Yes.
But they pushed them aside, or they, out of sight, out of mind kind of thing.
Yeah.
And so, yeah, you're right. We just didn't see it as much. It wasn't reported as much. It wasn't diagnosed as much. And so it just seemed to be a different world. But perhaps it was always there, but we just didn't.
We didn't
put a finger on
recognize it.
Yeah.
Before my father died, about a year and a half ago now, he and I were having a conversation. It was around my granddaughter. And what he said to me is, he says, you know, Susan, I don't know what's going on. These kids, something's different. When I was a kid, we didn't see children like this in school. Maybe there were one or two, and they were considered incorrigible, and they would be put somewhere in an institution. But I don't understand why all these children now need these treatments, why they have to be on medications and so forth. And it really got me to thinking again, it's one of those things where, are we treating it differently? Did it not exist? There are some people who wonder if part of this is environmental, even if there are environmental issues with chemicals and preservatives and that type of thing that are making this worse. Don't know the answers, but the negative side is there's a lot of kids in pain out there. And their parents and their families are in pain as well. Because when a child has mental illness, it's not just the child who is affected. It's the entire family unit.
Absolutely.
I remember we used to always talk about the sandwich generation, so you had the parent, also helping them take care of their parents and having their own children. But think about a family that has issues on both ends.
Absolutely.
Oh my goodness, it's
where the dementia or other things are setting in, and then a child who has challenges as well. My goodness. And is there enough help out there anymore? And then we're talking about budget cuts and all that. Wow, it's tough, And
I don't know where we're going to go. I really don't know where we're going to go with this, because if nonprofits who are really bearing a lot of the brunt for the services that they're talking about making cuts to receive 10 or 20% cuts, when reimbursement wasn't necessarily keeping up with the actual expense or the actual cost of services to begin with, how else are they going to function? There's more demand than ever, and now we're going to have less resources, because these organizations really aren't going to have much choice other than to either start eliminating programs or laying off staff. And I'm not sure what we're going to see. This looks like it's going to be the new reality for human services, and it's frightening.
It is frightening. So what would you recommend? Let's say someone is the child is newly diagnosed, or a parent is newly diagnosed, and this family doesn't know where to go. Where should they turn to first? What advice would you give to somebody who's watching this program saying, that's us right now, and we're stumped? What should they do?
Okay. There's a number of things that they can do. Interestingly, what you want to do, I think, is to be aware of what signs might start to exhibit in a child that would show that maybe they do have some sort of a mental health diagnosis, whether it's attention deficit disorder, attention deficit hyperactivity disorder, or whatever. Start knowing what the symptoms are. Start admitting to yourself that maybe your child can be depressed, even though how is an 8-year-old depressed? Well, sometimes they are. Learn the signs and the symptoms. And when you start seeing those signs and symptoms, that is the time then to start contacting professionals. If you have private pay insurance and can afford the copay, there are a lot more child psychiatrists, psychologists, and so forth. A lot of times you can start with the counseling, and the counseling will help. With some children, however, then we have to get into some medication issues. No one likes to do it, but sometimes that's what is going to be necessary to help this child. There are nonprofit organizations out there as well that are providing mental health services. A few of them that we fund through our United Way would be Catholic Charities, and you don't have to be a Catholic to seek services from Catholic Charities. They have a wonderful counseling and mental health component for children as well as adults. Presley Bridge in our community. Used to be known as Family and Children's Services.
Sure.
Wonderful reputation as well, and they actually have some in-school programs as well that are available where kids are being treated in the schools. Northwestern Human Services Stevens Center is another one, and they actually provide some services up in Perry County, which is especially nice. So we have kind of all ends of the county that are covered with them, with the 3-county area.
Fantastic, good stuff. Yeah, you know, you also wear another hat at United Way, and that's allocations, and that's a process that not everybody is always aware of, and that's a massive process, but a very necessary, needed process. Tell us people a little bit about that and how that works.
Okay, glad to. Our allocation process is something that we're very proud of at United Way, the Capital Region. It's also something that unfortunately is the best kept secret. Nobody's trying to keep it. But people just tend to think that staff over at United Way, the Capital Region, are sitting there and making decisions about where the money the donors contribute are going to go. That's not true. Every year, and we begin recruitment in the fall, we will recruit volunteers who will come in, be trained by us on how to make allocation decisions. They will go out and visit the agencies they're assigned to review, and then they will actually review proposals and interview the agency staff. And based on their investigation of the programs, taking a look at their program results, you know, their outcomes and that type of thing, they will then make some determinations about where the dollars should go. And it's a wonderful process, and it's something that you don't, if you want to apply, you apply, but it's not an application process per se, because really, if you have an interest in doing this, you're accepted for it. What we want to do is we want to have representation of our donor base. And our donors at United Way come from all walks of life, and we want to make sure that everyone has a chance to participate in the process. So that's something that we generally will recruit for September, October timeframe. And anyone who would be interested in taking part of that could give us a call, and we would be happy to put their name on the list for the fall recruitment if they have the time. We would love to have them. One of the downsides for some people is it does take place during the workday, and not everyone is able to get time away. I think there are some companies who are very generous and want their employees to get involved in community volunteerism, so sometimes they will give them some berth in terms of time off and that type of thing to participate in the process. The allocation process basically is limited to what we call our program partners. And that's 39 or 40 nonprofit organizations that offer around 70 programs that we fund. And those programs are ones that we have at this point in time funded for a minimum of about 5 years. They are also programs that, while they may not rise to a level on a needs assessment right now, they're really integral to the overall health of our community. And if we were to pull the plug on those programs, we could very well start seeing a rise in the issue that they're serving. So that's the allocation process. On the flip side, we also have what we call our Community Response Fund. And the Community Response Fund is open to all 501c3 nonprofits in the area. And our focused care councils, the 3 of them, which are health, basic needs, and education now, they come up with what they feel are the needs, the pressing priority needs in our community that need to be addressed. Over the past couple years, it's been what we've called family economic stability, which is basic needs, and access to health care. We will then put those priorities out there and submit or request proposals from organizations for programs that will meet those particular needs in the community. And we will fund those. In this past year, we had about $200,000 that we were able to make available to organizations.
What is the maximum that an agency or can apply for under that?
Under Community Response Fund right now, it is $50,000, which is still a nice size grant. If we say nothing lower than $5,000, nothing higher than $50,000. I would say most of the grants we're making right now are running between about maybe $25,000 and $30,000. Is where most of them are coming down.
And it's not I heard someone say it's not a hard process,
No.
but it's not an easy process, but it's an involved process.
It's an involved
Yeah,
process, and it
okay.
does involve an online application.